Well, welcome back if you're joining us. This is Channel 1 News Hour. It's time for us to focus on your health. And particularly this evening, we will be looking at how do you protect your eyesight. And we will be focusing on the cornea. We'll be getting to know what the cornea does and where it is located in your eye, and what are some of the available treatment options in the event that you go to perhaps getting cornea blindness. And those are some of the issues that we'll be looking at. What are the technologies that are available? And that discussion will be guided this evening by Dr.Jyotee Trivedy, who is from the Dr.Agarwals Eye Hospital here in Nairobi. Thank you very much for joining us this evening.
Jambo.
All right, and let's just begin with, we're talking about the cornea. What exactly does it do in the eye?
Okay, cornea is like the clear transparent membrane of the eye.
Which is called the window to the soul.
Yes, basically. It's the center part which is seen at the first sight. That's the clear transparent, though people think it is black, or the color of the iris gives the color to the cornea. That is what they think, but it is a transparent, dome-shaped, globe-shaped lens type. It's a clear transparent area whereby the light enters through the cornea, goes through the lens and onto the retina to form an image. So the cornea actually is one of the important organ, or it is a part of that eye, basically, whereby we can get the image of the eye, or we are able to see well.
So what is its connection to tears? Because I hear about the cornea and tears. What is the connection?
Okay, the tear ducts which are there available in our eyes, they are producing tears, and every 1 minute you will find that 1 ml of the tear film is formed over the cornea. If the cornea becomes dry, then you will not be able to see well. So when you blink, you will find that a tear film is formed in front of your eye and you are able to see well. So the tears and the cornea will go well hand in hand. The cornea is an avascular organ, so there are no vessels which are given, so there is no nutrition. The nutrition which comes to the cornea is from the air or the tear film which we are talking about.
So that brings us to the question about what are some of the conditions, the common conditions that are associated with the cornea.
The common conditions with the cornea is that, congenitally you can get corneal opacities. So you can get white cornea congenitally when you are born. If the mother has some maternal infections or something like that, then congenitally you can get. There are other things that trauma, blunt trauma, chemical trauma, physical trauma, you can get on the eyes whenever you are just walking around, and in children. Mostly the age group of the school-going children, whereby you will get a pencil injury or something like that. So when the pencil injury happens, then the transparency of the cornea will go and it will become white in color. And then the transparency goes, then the light will not enter through the lens onto the retina to form the image. So that is other condition. The third condition is that you will get patients with having cone-shaped corneas. So you will have those cone-shaped corneas which are called keratoconus. The kerato means cornea, conus means cone-shaped. So keratoconus means you will get actually the globe-shaped cornea will become cone-shaped cornea. So the length of the eyeball will increase and your numbers will keep on increasing as your age grows. Your eyeball increases or it develops till the age of 15 to 16 years of age. So the eyeball will keep on increasing. So if you have a spectacle number when you are small, then it will keep on increasing as you age till the age of 15, and it stabilizes after that.
So can you correct that particular condition?
Yes, you see, you can correct the refractive errors by giving the glasses to the children. That is main thing. The other thing is that the congenital opacities, we need to find out what kind of opacities are there and to what level they have gone into the cornea. Cornea has 5 layers. Okay, so if it is superficial, the first layer and the second layer, you are able to correct those corneal opacities very easily by medicines and all. There is no requirement.
When you discover them early on. Okay.
Absolutely, but when it goes to the third layer, that is a stroma layer, then it is impossible for us to clear it with the medicines. Then you have to get a surgical option for that.
Okay.
That is what it is. For the keratoconus, basically, what has happened in Kenya, there is almost 19% of corneal blindness. Out of that, the main cause of it is keratoconus.
Okay.
And it is in the range of 3 years of age till 30 years of the age.
3 to 13 years of age. All right. What are some of the symptoms that perhaps you should look out for to tell if you have an eye infection?
If discharge in the eyes, redness in the eyes, you can have foreign body sensation in the eyes, you will tear from the eyes, so these are the basic minimum. And loss of vision means little bit loss of vision also. People will understand that now I am not able to see this. I was able to see in the church, I was able to see this. Now today I am not able to see that. So that drop in the visual acuity will, these are the main symptoms which they will.
But how often do we seek their treatment when we notice these things? Because the eyes are always tearing every other time. Sometimes you can sleep and there's redness in your eyes, so you're not really sure when to get checked out.
I feel that whenever you have a loss in the visual acuity, so there is decrease in the visual acuity, redness which has persisted more than 48 hours, you have tearing which is more than 2 to 3 days and it has not stopped, and you feel that there is foreign body sensation, you are itching for more than 5 days, yes, you need to seek an opinion. Definitely. All right,
let's talk about the eye drops, which a majority of us actually tend to fall back to. The ones we were always grabbing an eye relieving, just trying to remove the redness from our eyes. How safe is that for us?
Basically, you should never buy a drop which is over the counter. That is what I would suggest, because the thing is that whenever you go over the counter, your condition is not diagnosed. You are just given for the redness. What is the cause of the redness has to be established first before we have to give the treatment. So over the counter medicines, I wouldn't want to believe in it. I feel that you should seek an ophthalmologist opinion so that you can take the proper medicine for the cause of that redness, because redness can be for many reasons. You see, there can be many reasons that you can have infection, you can have inflammation, you can have foreign body, like you can see the welders or anybody who is working on the welding machine, some iron particle can just enter into your eye and get stuck onto the cornea. So you can never know that there is that iron metal particle which is, and it keeps on rusting onto the cornea. So when they come to us, if it is too late, then the rust ring will remain there even if we remove that metallic foreign body.
Let's talk about light sensitivity. That is also another area that a majority of us are always just, donning the shades. I don't know if it's to look cool or just to protect ourselves from the, from the sun. How do you know what are the right spectacles to buy to protect yourself?
Okay. First of all, for the spectacles or the glasses which you have to buy is UV protective. Polarized. So you have to check whether your glasses, sunglasses are polarized or UV protected. And there is a method to measure that. There are some gadgets which are available in all the optometric shops or even refraction areas whereby you can check your sunglasses whether they are UV protected or not. But I feel that on the road which are sold are just film. There are films which are put on the glasses, plain glasses, and then sold to you. Sometimes they are written UV protected or they might not be UV protected. You should get it tested that these are UV protected polarized glasses. That is the time you can use. And it's not for looking cool. Yes, I am telling you, yes, because I feel that sunglasses are meant to protect your eyes from the sunlight. And as we talk, we are on the equator. You see, the equator, the sunlight is very near to us. So the sunlight affects us more than anybody else who is elsewhere in the other countries. So I feel that we should use the polarized sunglasses whenever we are walking out in the sun and not for the cool.
Meaning you have to go to, a medical facility to get the sunglasses. Yes. You just don't pick any.
Yes, please. Yes.
Okay. That is interesting. All right, let's look at, going forward in terms of how do we prevent, some of these conditions that are associated with the cornea.
Okay, main thing is that you have to teach discipline for the children when they are in the school going age, so that the trauma is not there. The pencils, basically the pencils, to cap the pencils is very, very important for them to understand that whenever you use and keep it back, you should cap the pencils. But I don't know whether it is a followed practice in the schools here or not, but they should do that. Whenever they have PE or whenever they have a physical education class or something like that, I think the teacher should be checking on them what they are doing, whether they are bending, what is happening and all that. Keratoconus is not a condition which can be stopped or prevented. It is a progressive condition which leads to the blindness. Rather, it is a reversible blindness.
So it's reversible or
yes,
not?
Yes, it is reversible blindness. So you can have treatment options for it, that whereby you can treat keratoconus so that you can make that child see to go to school. I have seen so many children who have been school dropouts, because because they can't see well. They cannot read, they cannot write, and the school teacher will say that, oh, they are not able to see well. So they can't see, they cannot write, so they are writing wrongly. So, you know, when they come to you, either they are having a refractive error whereby you can treat it, give them glasses, and they can start working. 1 in 6 children, 1 in 6 children will have a problem with the eyesight. So we will have to make sure that the schools are being screened for all these eye problems for them, definitely.
You talked about treatment options. Which ones are available?
Okay, for keratoconus, basically the cone-shaped cornea means we need to flatten the cornea or we need to make it globe-shaped.
So that is a surgery?
Yes. If there are 4 grades of keratoconus, so when it is for the grade 1 and grade 2, we will be able to do a procedure which is called cross-linking. The cross-linking is a procedure whereby we give UV light on the cornea with vitamin B2. Every minute if you put for 30 minutes, then it strengthens the cornea. So when you have that, it is not weakened, and we have strengthening the cornea, it will not become cone shaped. So we are stopping the progression of keratoconus. So when there is early keratoconus, we can do a procedure which is called cross-linking. But when it goes to grade 3 and grade 4, then it is an advanced keratoconus whereby your spectacles doesn't work, your contact lenses doesn't work, and you are not able to see well. That's the time is the surgical option which we give to the patient. And there are different types of surgeries in keratoconus. We have the basic minimum which we do first. The surgery which came was a penetrating keratoplasty. Means you have to go through and through the cornea. You cut a basic diameter of the cornea depending on the diameter of the recipient cornea.
Yes.
You cut it whole through and you replace it completely. Okay, that is called a penetrating keratoplasty.
You're replacing it with what?
Cornea, donor
that
cornea.
That means donor cornea.
Yes.
Okay,
yes.
we'll be talking about the donors in just a bit. But you mentioned the contact, lenses. How safe are they?
Contact lenses are quite good as long as you are able to see well and as long as you follow the instructions of the contact lens. That means that you have to assure that there is cleanliness of your hands when you are putting your contact lens and removing them. You have to make sure that if you are using soft contact lenses and you are using for 8 to 10 hours maximum, and if you are using hard contact lenses, that is RGP lenses they are called, then it should be only for 6 to 7 hours, not more than that. I have found people using for the whole of 12 hours.
Sometimes.
Yes, you cannot sleep with the contact lenses. If you sleep, I have gotten patients whereby the contact lens gets stuck onto the eye. Next day morning, they will call you that I'm not able to remove the contact lens because there is a swelling set in from the conjunctiva and it makes the contact lens not to come out of the eye. So you have to surgically remove it then. Yes.
Once you remove it surgically, is there room for recurrence or you're treated for life?
No. Once you do the surgical change of the corneal transplant, then the clients will be able to definitely see the patients and the kids will be able to see them.
Does it recur in
No,
life?
it doesn't recur, but they gain the shape of your original cornea. So it keeps on evolving as you remove the stitches within 1 year. So the treatment period will be like once you operate on the eye, the 1 year you have to make sure that you are putting the drops in the eyes to follow that graft, because there can be rejection if you don't put the drops properly as per the instructions of the doctors. So you have to make sure that you are 1 year putting the drops. At the end of 1 year, some people will remove the sutures on the eyes at 6 months, but some of them will remove the sutures after 1 year. Usually 1 year is recommended because then that time you can keep them off the medication and prescribe them the glasses if need be.
Let's talk about the cost. How much does it cost to go through this kind of surgery if now you get to the stage of blindness?
As I told you, the corneal transplants, we have to get the corneas and they are not available locally. You need to have a setup of an eye bank whereby you can get the cornea from the eye bank.
Do we have an eye bank in Kenya?
We have one eye bank for Lion Sidefirst Eye Hospital, but it doesn't cater for whole of the Kenya. So we need to build up an eye bank which is with the government so that all the rest of the ophthalmologists can get these corneas for their corneal transplants.
And how do we build that eye bank, given there are a lot of cultural factors that are made when you start telling someone to donate their eyes, I don't know. How do you plan on building this?
Actually, I have been doing a lot of work on this. I have done a study on this, that why there is no donation being done in Kenya, and I have found out there are quite a number of religious factors which I have come across. I have interviewed quite a number of people and all that. But nowadays the awareness has come into the people. It's just that the religious beliefs, or the beliefs that, oh, okay, when I die, I'll not be able to see the heaven, or when I die, how I will not know where I will go. But I feel that
you'll not be able to see heaven.
Yes,
if you live
but I feel that it's not like that. When you die, either you are buried, you are cremated. When you are buried in that, with due respect to all the religions and everything, when you are buried, your body will just go like that. Your soul is the one which either goes, it will go to heaven, I feel. So if you donate the eyes to someone who is leaving at the moment after your death, it will be one of the most beautiful gift of sight for the person who is blind and who is leaving.
So how soon do you harvest, the eyes if someone has already died? Is the exact time?
Within 6 hours of death, you will have to harvest the eyes, because after that the cells of the cornea will start dying. So within the 6 hours, we have to harvest the cornea, and we put it in a media which stays there. There are two kinds of media which will stay there. One is for 2 weeks and one is for 1 month. So we can put it in a 2 weeks media, or you can put it in 1 month media, whereby you can use it within 2 weeks, and the other one maybe within 1 month.
So after 1 month, it's useless?
Yes. It's useless, yes.
Okay.
Yes.
You didn't tell us about the cost. In the event that, we get an eye bank in Kenya, what would be the cost of, the transplant vis-a-vis now that we have to import it? What does it cost?
Now, at the moment, the cost price will come around 300,000 Kenya shillings, because we have to order the cornea from US, and it comes to through the shipment. We have to pay them for the cornea, and when it comes for the shipment, we have to do the customs clearance and all those things, and then come here, and then you have to make sure that the surgeon cost, the anesthetic cost, the theater cost, the consumable cost, all it is included. So cost price will come around 300,000 Kenya shillings. But if we have an eye bank here, this cost will be cut down so much far down, because you don't have to pay for the cornea. You just have to pay for the consumables, the surgeon and the anesthetic cost, or the theater charges or something like that. But if cornea will be free, you see, because the donations are given free, and that one will be given free to the patient, to the donor, by the recipients. So I feel that this organ donation should be
so what will be the rough cost if we were to source the eyes locally?
Around 200, less than even 200,000, 150,000 shillings. So around
about 100,000 shillings difference.
Yes.
All right. In terms of the technology that you're using to perhaps do the surgeries, what is there? Are we at the stem cell technology yet?
Yes, there is. Some of them for the chemical injuries which we are having, we use the stem cells technology because of the conjunctiva, but not for the rest of the eye structures. But for the conjunctiva, yes, we can do the stem cell transplant to make, because some of the chemical injuries, or Steven Johnson syndrome for that matter, who has sulfur allergies, and they will get some problems in the eyes. That is the time you can do stem cells transplant, which we do also, and that can lead to very proper eyesight for the patients.
What about for corneal blindness? What technology are you using?
For other technologies is one of the other method is DALK. I told you that the cornea has 5 layers.
Yes.
So you can transplant just the 4 layers on the top and leave the 5th layer of the patient on himself or herself. Just remove the 4 layers, dissect them, and you can transplant the 4 layers. And the third method which is there, that if only the 5th layer has gone bad in the patient, then you can just transplant the 5th layer there. It is just a very thin layer, maybe 20 micromillimeters in width or the density, and you just have to push it into the in the eye with 1.9 millimeters of incision, and it will go and it unfolds itself, and you have to put it onto the cornea from the inside. So actually we can do that third method also. So one cornea can maximum benefit 2 people and minimum benefit 1 person.
So in terms of the body, can the body reject, some of this? Are there side effects to this?
Yes. As I told you initially, that cornea is an avascular organ, unlike the other organs of the body like kidney, liver, lung transplant or heart transplant. Rejection rates are very, very low. So what happens is that in the cornea, whatever rejection happen is because of negligence, not putting the drops, not attending the clinics
so it's
very
more
fast.
Of the patient's
or
yes.
I have seen in my practice that when I do a corneal transplant, I find this kids are more prone to the injury to the same eye which you have transplanted. So I tell them not to play football, not to play rugby. So keep away from the football, keep away from swimming, and they can get injured very easily on that eye. And sustaining that injury is difficult for that donor cornea because there's still the sutures on for 1 year.
All right, our time is up. But in terms of the follow-up, how do you follow up on patients who have already got, the transplant?
If the transplant is done for the first 1 month, I have to see them every weekly. Then for the next 3 months, I have to see them every monthly. And the next 1 year, every 2 months, I have to keep them see. Whenever the sutures are loose, I have to cut the sutures off, remove them, because the loose sutures can lead to the infection. So you have to cut the sutures off from the eye and keep on changing the drops. So when they are on higher steroids before, we have to bring them to the lower steroids so that they can be tapered off the medications at the end of 1 year.
All right, our time is up, but I'll just give you a moment to look into that camera and try to appeal to the Kenyan people to donate to the eye bank, so at least we can bring this cost down and help someone get their eyesight back.
Thank you, Catherine, so much. Thank you so much, KBC, for inviting me here. And I am here just to spread the message that cornea awareness should be done so much, and we need to donate the corneas. This will be the beautiful gift of sight to the people of Kenya. There are quite a number of children who are blind and who are not able to see well, cannot pursue their studies, and they are the future citizens of Kenya. Thank you so much.
Thank you so much, Dr. Jyotee Trivedy. Of course, we wish you all the best as we try to build our eye bank. We appreciate you coming here this evening and giving us more insight on what you're doing. We really appreciate that. Well, that is Dr. Jyotee Trivedy from the Dr.Agarwals Eye Hospital here in Nairobi, just putting into perspective the importance of donating to the eye bank and what they're doing to try and give the gift of sight.